Phenazopyridine, mechanism of action. Good afternoon, everyone. My name is Noemi Leitz. I'm a PhD student in the Liquor Lab, and today I'd like to explain you more about how we discovered that phenazopyridine exerts its effect as a urinary painkiller by the inhibition of TRPM8. Phenazopyridine has been on the market for almost 100 years. However, we don't know exactly how it works. It is supposed to have an analgesic effect on the mucosa of the lower urinary tract. That's why it's sometimes prescribed to patients post-surgery, those with indwelling catheters, or in combination with antibiotics during a urinary tract infection. A completely different group that can benefit from phenazopyridine are those patients with interstitial cystitis or bladder pain syndrome. A big study has looked at the patient-reported outcomes, and we can see here that 61% of the patients reported improvement of their symptoms when they used phenazopyridine. However, we don't know exactly how it works. But this didn't keep physicians from prescribing the drugs, as it was the third most prescribed treatment in the United States. This got us thinking that we want to unravel the working mechanism of phenazopyridine and that there could be a possible link with TRP channels in the bladder. Especially when we saw this report that described an increased expression of TRPM8 in bladder biopsies of interstitial cystitis patients. Thus, as we believe that TRP channels might play a role in the mechanism of action of phenazopyridine, we screened all relevant channels in the bladder, being TRPA1, V1, V4, M3 and M8. We used calcium imaging to determine any agonistic or antagonistic effect of phenazopyridine, and the most robust effect was seen on TRPM8. As you can appreciate here, when we activate the cells with menthol, we saw that the responses were inhibited by increasing dosages of phenazopyridine. So there is a dose-dependent TRPM8 inhibition with an IC50 of around 10 micromolars. This effect was also seen when we induced the TRPM8 responses with a cold stimulus, so not only with menthol. Here you can appreciate that during a cooling phase that there is an increase of calcium influx in the cell, so there is a response. If we apply this cold stimulus together with phenazopyridine, there was no response, and afterwards the responses were again back to normal and even higher when we co-applied menthol. Here you can see the normalized responses to the first cold stimulus, that when we co-applied it with phenazopyridine, it was significantly reduced. In a next step, we performed whole cell current patch clamp measurements. Here you can see the whole cell current time course at both minus 80 and plus 80 millivolts. The cell was stimulated continuously with menthol at 50 micromolars, and an increasing dosage of phenazopyridine was added, and then AMTB, a known blocker of TRPM8, was also used as a negative control. You can see that there was a rapid and reversible inhibition of the whole cell current, which was most pronounced for the inward current. This can also be seen in the current voltage relations, where all the colors here correspond to this graph, or to the time point indicated in this graph. The inward current was more rapidly blocked, and here also the IC50 is around 10 micromolars. To validate these previous results that were all obtained in transfected Higgs cells, we decided to look at the dorsal root ganglia. It's the cell body of the sensory nerves that innervate the bladder, and we performed another calcium imaging experiment. Here you can see in light gray most neurons will not respond to menthol, but about 5 to 10% of them will respond to menthol, so they will express TRPM8, and it is these neurons that we have analyzed, and if we co-apply menthol together with phenazopyridine, we can see that it, again, even in dorsal root ganglia, inhibits the activation caused by menthol. And here it's also looked at a normalized response to the first menthol stimulus compared to when it's co-applied together with phenazopyridine. So in general, we can conclude that phenazopyridine inhibits TRPM8, and this might be a possible explanation of how it exerts its function as a urinary painkiller. Thank you very much for your attention.